Thank you, Mr Deputy Speaker. I rise to speak on the Australian Organ and Tissue Donation and Transplantation Authority Amendment Governance and Other Measures Bill 2021, which seeks to transition the role of accountable authority under the PGPA Act from the board back to the CEO and replace the existing governance board with an advisory board under the Australian Organ and Tissue Donation and Transplantation Authority Act 2008. This amendment will enable the board to have more strategic and advisory role. Mr Deputy Speaker, this bill is an important technical change to ensure improved governance and strategic intent of what is a very important authority. There will be no change to existing roles and functions of the Organ and Tissue Authority, and the Advisory Board will continue to have access to the responsible minister and be free to focus on strategic activities. The governance changes will align the Organ and Tissue Authority with the governance structures of most other non-corporate Commonwealth entities. So, to put aside this amendment, I'd like to speak further about the importance of organ donation. Organ donation is a gift. It's a gift of life for thousands of Australians. Indeed, it's a gift of life for millions of people worldwide. And organ donation is a very sensitive topic, and it is very prone to changes in the environment. In 2020, we saw a big drop in organ recipients. It's a disappointing decrease from the previous year, and it was due to COVID-19. It was actually a result of a decrease in the number of organ donors. Now, hospitals have faced so many challenges through COVID, and we know that the health system has had to pivot significantly through what has been a dreadful pandemic over the last 18 months. Hospitals have faced logistical challenges, including flight reductions and border closures, and we've heard some really devastating stories of patients not being able to travel across borders to capital cities that have been closer to them and have had difficult outcomes from a health point of view as a result. But this has basically affected the national program of organ donation throughout the year. There have been precautionary steps taken with the transport sector suspending adult kidney and pancreas transplant programs, and this occurred from March to May in 2020, and there's been rolling difficulties with rolling lockdowns subsequently. Elective surgery, including kidney transplants, was suspended late March last year as well, from late March last year. But I'd just like to say that Australian doctors and nurses have been working conscientiously to ensure the impact of these events on patients are minimised, and they should be congratulated. It's a very difficult place to be working when you have the gift of a life being shortened by the fact that COVID has had such a significant impact. But one of the bigger issues for Australia is that organ donation and consent for organ donation is something that needs to be addressed even further. In Australia, we know that 58% of families consent to donation when asked in a hospital setting. It can be a tragic time when you're beside the bed of a loved one, going through those agonising last few days and hours, caring for them, and then after the event, having to make an agonising decision about whether the organs of your deceased loved one will be the gift of life for others. But Australian families understand that gift, and they have given over and over again. But only 34% of Australians are registered on the Australian Organ Donor Register. And we must make organ donation a national priority to increase awareness of the benefits of organ donation for all Australians. Now, Madam Deputy Speaker, there are different types of consenting processes around the world, and there is a hot debate in the medical research literature about what is the best form of consent. And of course, ethics, culture, faith-based approach, all of those sorts of issues play into the culture of a country and the approach a country may take to different forms of consenting processes. There is what is called hard versus soft consent. And when we talk about different forms of consenting, we talk about opt-in or opt-out. In Australia currently, we have an opt-in situation. And as I said before, when asked whether they would like to have their deceased one's organs donated, Australians over and over again do consent in the vast majority, but that number could be increased. And it's very important that everyone in Australia should think about having a conversation with a family member. And that's because you never know, unfortunately, if you end up being in that situation. And what we do know is that over and over again, our patients' requests for their end of life can be overturned by their family members who are obviously distressed and in very difficult situation, having to make decisions. And sometimes the overturning of that decision can mean the loss of a precious donor organ. So there is the option of opt-in, which Australia currently has, but there's also the option of a system that is based on opt-out. And opt-out across the nation can have a spectrum of policy. There is a hard consent system where organs would be removed after death if the individual has not opted out. And most people don't support that form of utilitarian approach. It has an authoritarian concept, and it's something that most countries would not agree to. But there is also a soft consent system for opting out, where there is a presumption of favour of donation, a presumption that most people would be willing to give if they were given the opportunity, but that the final say rests with the families and loved ones themselves. And I believe that Australia is ready for consideration of an opt-out situation, that the presumption that people may like to be considered for organ donation as long as their loved ones and family are apprised of the situation and their views. We know, unfortunately, that less than 1 in 5 Australians have had these sorts of discussions with their family. And if there's one thing I would urge Australians to do is to have that conversation. The one thing about opt-out is it gives Australians an opportunity to put this conversation front and centre. Now, Spain is a country that has had an opt-out system for many years. And in fact, it is the leader in organ donations and has been for the past 26 years. Now, there is arguments about why that is the case, and certainly when it first introduced its opt-out processes, they took a while for the organ donation rates to increase, but it now is the world leader with regards to organ donation, with 46 organ donors per million people in their country. We've also seen that other countries have seen the success of Spain and have also moved to an opt-out situation. So England last year changed to the opt-out system under the newly introduced Max's law. As I said before, Australia currently has an opt-in system whereby an individual must record their consent with the Australian Organ Donor Registry. And Australia currently sees roughly half the frequency of organ donation that Spain has. Now, Madam Deputy Speaker, in my former life I was a paediatrician, and I trained in a fellowship program in the United States of America in a liver transplant program. So I've had a lot of experience, professional experience, being involved in liver transplantation. In fact, the University of Chicago, where I trained, was the preeminent paediatric liver transplant unit in the world and undertook 65 liver transplants each and every year. And in fact, our unit had undertaken the world's youngest liver transplant, which was undertaken in a 12-week-old baby who had a neonatal form of liver failure. And it was an incredibly young liver transplant to be undertaken. And subsequently, I've also worked in Australia, and I know how awful it is when a family is waiting desperately with their child for a precious organ so that they can help their child to live a more normal life. Research suggests that opt-out countries see 32% more organ donors. If that was to happen in Australia, a 32% increase would translate to 148 more organ donors saving and transforming the lives of roughly 405 Australians. I believe Australia is ready for a conversation to consider opt-out going forward, with hundreds of Australians privy to the life-saving benefits of such a scheme. Australia is a world leader in successful organ transplant outcomes. We clearly have the skills in our medical industry, but we always need more willing donors. The key to Spain's success may not simply be the opt-out system. It may also lie in the fact that they employ medically qualified donor coordinators, and that is an essential aspect of the system, is that intensive care specialists who are busy working to save lives should not be given the job of consenting families for organ donation. So it's very, very important that an independent, medically qualified third party is engaged in the issue of consent. And we know that in Spain there's been a large amount of resources directed to ensuring that every hospital has a medically qualified donor coordinated. And this has had significant positive effects in Spain, but in other countries too, such as Italy, Portugal and Croatia, which have also followed suit, with each of these countries privy to larger donor rates than Australia. There is no doubt that the adeptness of the Australian medical industry has had a very successful organ transplant. We know that we've got some of the best surgeons in the world, but we need Australians to put up their hands as organ donors and speak to their families regarding their wishes. We need Australians not to think of just the prospect of being an organ donor, but that of being an organ recipient. The need for organ transplantation can come at any time, even to the healthiest of individuals. With only 1 in 3 adult Australians registered to donate organs, but 69% believing it is important to do so, now is the time to have the conversation of how we can increase donor rates. Australians are the ones to do it. Now, in Australia, we've got the different states and territories having different forms of legislation and different types of services, and there is a huge range of donor registration rates across Australia. The Northern Territory, unfortunately, sits at the lowest rate at 14%, but I'm pleased to say South Australia has the highest rate at 71%. And South Australia is the only state where individuals can register to be a donor on their driver's licence, and I really welcome this initiative. I think this is a really great way to make sure people think about this form of care. The likely reason that this is there is why they have their highest donation rate. And we will see, if that is introduced to other states, it has the potential, a powerful potential, to influence the lives of so many Australians. And I'd just like to mention the story of Jim, who has been a recipient of an organ transplant. He became jaundiced overnight, and within a week he'd been flown by air ambulance to the Royal Prince Alfred Hospital. Doctors were confused as to how a healthy 49-year-old man suddenly became life-threateningly ill and why his liver was shrinking and dying. Within 3 days, his major organs began to shut down, and he was to pass away if he did not receive a liver soon. Luckily, a liver was available, and he pulled through with this massive operation that was life-saving. This story is just one example out of over 1,000 every year in Australia where someone has benefited from the gift of life of an organ transplant. And I had a similar experience, or many similar experiences, in the United States when I was a fellow in the liver transplant unit with a young girl, a 12-year-old girl, who had non-A to non-E hepatitis, and she was waiting desperately for an organ transplantation, had a number of days to live in intensive care, and her uncle from Texas, who had actually not spoken to her family for many years, came forward after there was a public request to try to save this young girl's life, and he became what is called a living organ donor, where he donated part of his liver to his niece. And that was an incredible story, an incredible experience to be part of, watching a child's life saved by her uncle, someone who she hadn't seen for many years, and it was a reuniting story as well for that family. We can speak about numbers as much as we like, but in the end, we are dealing with human beings, and every single human is important. To conclude, Madam Deputy Speaker, this is an incredibly important area of medicine. It is life-transforming. It can be a difficult conversation for people to have, but I encourage those listening to understand the gift of organ donation is an incredible one, and it's treated with the utmost respect and dignity it deserves by those medical health professionals who are doing the work and by those families who are there receiving the outcome. As the National Advertising Campaign slogan goes, become an organ donor. Heaven knows we need them. I commend the bill to the House. Thank you, Madam Deputy Speaker.
The question is that the amendment be disagreed to, and I give the call to the member for Hindmarsh.